you recently had eye surgery, such as LASIK or cataract surgery, and feel like your eyes are irritated and scratchy, you may be suffering from mild and temporary dry eye disease after eye surgery. And if so, you need to use a good preservative-free eye drop that can soothe your eyes quickly, help your eyes heal, and keep your vision clear. Which one should you use? Hello everyone, this is Dr. Audrey Tai. I'm a board-certified and fellowship-trained refractive and cataract surgeon, ophthalmologist, and cornea specialist. Welcome back to iChannel by Eye Surgeon. Shortly after eye surgery, you often need to use different prescription medication eye drops frequently to prevent infection and reduce inflammation. Those medication eye drops disrupt the normal tear film on the surface of the eye, so you may experience temporary dry eye disease after your eye surgery. Surgical incisions on the surface of the eye may also cause irritation. In order to restore the moisture in our eyes, you will need to use a preservative-free lubricant eye drop that contains ingredients to promote healing on the surface of the eye. I often recommend Optase Hylo Relief Dry Eye Drops for my patients to use after their eye surgery. Optase Hylo Relief Dry Eye Drops contain 0.25% glycerin as its main lubricant. Glycerin promotes surface cell growth in our eyes and reduces the osmolarity or thickness of the tears to help the tears spread out more over the surface of our eyes. It also contains long-lasting hyaluronic acid. Hyaluronic acid is found naturally in the eye where it is produced as a response to injury to the surface of our eyes to promote healing. And it can reduce mucus strands in our tears. Optase Hylo Relief Dry Eye Drops are stored in the unique Hylo delivery system, an innovative multi-use drop bottle that maintains sterility for 6 months without the need for preservatives. It accurately dispenses 1 drop with each click, significantly reducing unwarranted waste and allowing a minimum of 300 calibrated drops. To use the Hylo eye drop, wash your hands well before each use. Remove the overcap and invert the bottle with its tip pointing down. Place 2 fingers on the base of the bottle and your thumb on the shoulder of the bottle. Put the lower eyelid down and positioning the bottle over the eye. Press the base and to release 1 drop. After each application, slowly close your eye to allow the fluid to spread evenly over the eye surface. Then replace the cap back on the bottle. Make sure you do not touch the tip of the bottle with your eye, your skin, or your fingers to avoid contamination. For my patients who work in front of computers daily, I also recommend using Optase Hylo Relief Dry Eye Drops 2 to 3 times a day to prevent eye irritation from digital eye strain. And the Hylo eye drop provides instant but long-lasting lubricating effect without blurring the vision. Have you tried the Optase Hylo Relief Dry Eye Drops? How does it compare to other eye drops you have used? Let me know in the comments below. I hope you'll find this video helpful. If you have learned anything new from this video, please don't forget to hit the like button and subscribe to my channel to help me bring you more videos about eye health and eye surgery. You can also follow me on Facebook and LinkedIn at Dr. Audrey Tai to learn more about my practice. Thank you again for watching, and I will see you in my next video.